Hi guys, so I will be presenting to you my presentation on schizophrenia. I will be covering what it is, some stigmas pertaining to being schizophrenic and schizophrenia as a whole, signs and detection, various types of schizophrenia, as well as treatments. What is schizophrenia? Schizophrenia is a disorder characterized by delusions, hallucinations, disorganized speech, and/or diminished inappropriate emotional expression. There's something called chronic schizophrenia, also known as process schizophrenia. This is a form of schizophrenia in which symptoms usually appear by late adolescence or early adulthood. As people age, psychotic episodes last longer and recovery periods shorten. There's also acute schizophrenia, also known as reactive schizophrenia. This is a form of schizophrenia that can begin at any age, frequently occurs in response to a traumatic event, and from which recovery time is much more likely. The picture on the right is art by someone diagnosed with schizophrenia. This was displayed at a art show by Craig Gazer in 2010 in an art exhibit in Michigan. Stigmas. People with schizophrenia are useless and unproductive, mostly withdrawn and frightened. They are a danger to others. Fear of the unknown and unpredictable. Someone with schizophrenia can't be helped. More likely to harm themselves and/or others. Well, these are just practically myths. Schizophrenia is a medical illness. It must be treated by qualified medical professions with medications. Schizophrenia is not just split personality. Most patients with schizophrenia prefer to be left alone and do not harm others unless severely provoked. Also, with proper medication, treatment, rehabilitation, and supportive environment, many patients have been able to hold jobs and take care of their homes and their families. So here's a little column with some positive, negative cognitive symptoms when it comes to schizophrenia. The one I wanted to talk about was the blunted effect. The blunted effect is also referred to as emotional blunting. It is also a prominent symptom of schizophrenia. Patients with blunted affect have difficulty in expressing their emotions, characterized by diminished facial expressions, expressive gestures, and vocal expressions in reaction to emotion-provoking stimuli. There are various types of schizophrenia. You have undifferentiated schizophrenia. This is where a patient's signs do not fit into a subtype. Disorganized schizophrenia. This often occurs in adolescence. Inappropriate emotions. Paranoid schizophrenia. You have paranoid delusions focusing on the self, belief in being targeted by people, objects, and/or others. Catatonic schizophrenia. This is reluctance to move limbs, body. Some also engage in repetitive behavior. Then you have residual schizophrenia. This is a history of negative schizophrenic symptoms with infrequent positive symptoms. Treatment is usually lifelong and often involves a combination of medications, psychotherapy, and coordinated specialty care services. So usually when it comes to treatments, it's not either or. Treatment does come in both forms, medications and therapies. So you're most likely not just going to be taking any medications or just going to therapy. You're not only going to be taking medications, but also going to therapy. Some therapies include support groups, rehabilitation, cognitive therapy, psychoeducation, family therapy, behavior therapy, and group psychotherapy. I think this is my favorite slide out of the whole presentation. Um, so if you didn't know, John Nash is an American mathematician. He is also a Nobel Prize winner in 1994, and he is schizophrenic. You have A Starry Night by Vincent van Gogh. A lot of people maybe, I guess, came to the conclusion or thought just by his paintings that he's schizophrenic, but he actually is schizophrenic. Then you have Syd Barrett. He is part of the band Pink Floyd and was also diagnosed a schizophrenic.